Thank you for coming. I know that we all have very busy schedules, and so I do appreciate your presence here. And if we could, just real quick, we'll go around the room just because we have some community representatives here with us, and we want to make sure that they're seen and recognized. And we'll start in the back. Ms. DuBose.
Dr. Rox Polpot from Precise Urgent Care.
Sharon Croak with the Coalition.
Carlin Womack with WellPoint Medicaid Managed Care.
Who brought us gifts. If you didn't get a hand sanitizer, be sure to pick one up. Thank you, Carlene.
You're welcome.
Mary Machuga with the Polk County Sheriff's Office.
Jennifer Birdwell, Director of Communications for LISD.
Kelly Bradley with the Department of State Health Services.
Angie Patrick, Timber Creek Elementary.
Diane Houston, Lead Academic Advisor at the high school.
Robbie Benson, Dean of Students at Cedar Grove.
Bria Morris, PD teacher at Cedar Grove.
Chloe Isaacs, PE teacher at Timber Creek Elementary.
Heather Duke, Dean of Students over at Pine Ridge.
Kayla Mays, the school nurse over at Pine Ridge.
And I'm Lana Smith. I'm the Director of Student Services. And videoing in the back today is Ms. Aubrey. We're going to get started, and I have had this on the agenda. We do need a parent chair for the Shac committee. So if you know of a parent who is not an employee of the district that would be interested in chairing, it's not a one-person job. They would meet with me and kind of decide what needs to be on the agenda and what to talk about if we have any presenters that reach out that would like to speak. So we would do it together, so it would not be a solo effort on their part. I did want to point out again, we do have a Shac page on the LISD website that has all of our meetings and our agendas and the minutes of the meetings, and it also has some resources on here for parents and for staff and students. Our wellness policy plan is listed on here as well. So if you haven't had a chance to kind of browse through that, just know that that is there, and that's kind of where we house all of our information. October is Fentanyl Awareness Month. And so if you didn't get a pink handout, we definitely want to participate in that. That's a fact sheet that Texas Education Agency, I believe, put that one out. So I just made a copy. We also did, I'll just see if I can go here. We also have listed some information on our social media pages to help bring awareness to it. If you're not familiar with fentanyl and the effects that it's having, I would encourage you to kind of look into that and be aware of it. And it's something that we also want to make our parents aware of. We did send out a parent letter, just some informational talking points that they could, use with their children if they so choose. And we sent out a letter to our staff to make them aware of it, just trying to get awareness out there. We've made some changes to our website, our webpage, the Livingston ISD webpage, and so these resources have been posted. So one of the things that we put up for parents are like common emoji codes that they use and what they mean in those text messages, because this is one of those areas, if they've become very creative on how to talk about access and or gain access to fentanyl and to drugs. And so it's just an opportunity for us to help make parents aware of what's going on, just so that it's okay to ask questions, about what you see on your child's phone. And so just to kind of help with that. And so the one pager that you have on the pink sheet is just informational for you. It's not something that we created. So if you need to use it with your organization, please feel free to do so. I will. And so we have a presentation this morning, and so I will introduce Sharon Crook and hand her the microphone. She's going to visit with us she's from the coalition, and she's just going to visit with us. And we are partnering with them through the high school for some activities, and she'll talk about that too as well.
Yeah. Can you make it so that that's up?
Uh-huh.
Okay. We got, it's still not there. The projector went to sleep, maybe?
Was mine up?
No.
Hit Windows and K at the same time.
How many times do I have to do that?
Should.
Oh, it's trying.
So the whole time I was talking, were y'all able to see
No.
an agenda?
No. I wondered because you were moving your mouse around like maybe it was a pointer, and I was like, I wonder if we're supposed to see that.
It's okay to say,
Yeah.
realize we can't see anything.
Just click the presentation button down. There. Yes? There we go. Okay. Thank y'all for letting me be here today. I'm super excited. We're actually super excited to be working with Livingston. We tried for most of the year last year, and finally towards the end of the school year, we were able to partner with the high school and create a Livingston High School Drug-Free Council. And so we're really excited about it. Ms. Goki is the sponsor over there, and she's got several kids already that are members of that club, and we're really excited to see where it's going to go. So I just wanted to kind of go over what a drug-free council is, what the coalition does, just so that you'd have that information, and then for any ideas that y'all have maybe for collaboration. So the coalition was founded in 1988 by the 6 school superintendents in Angelina County and our district attorney, and they just wanted one organization to kind of bring together all of the drug prevention efforts that were going on, drug, alcohol, and tobacco. We're founded on a national model. We have a national organization called CADCA, and we follow these 5 different principles about environmental change versus individual change. And so I'm just going to walk through those principles, and that'll give you an idea kind of what the drug-free councils are doing. I should say we're based in Angelina County, but we recently got TxDOT grants to cover Polk County and Cherokee County. And those TxDOT grants are focused on preventing underage drinking, obviously, because they don't want the drinking and driving connection, right? That's what TxDOT's most worried about. But because we also have some local funds that we can use from other different grants, we can focus on other drugs. We can do alcohol, marijuana, e-cigarettes, any fentanyl, any of those things as well. So the first 2 components of environmental change are collaboration and enforcement. Collaboration, you can see there's a picture of Ms. Goki right there. She was recruiting for the Drug-Free Council at Livingston High School, and that's a little picture of the logo that we have for Drug-Free Council. We partnered with the Gear Up program over at the high school and did a presentation for some of their parents. And then the enforcement aspect is we have, TxDOT gives us, part of the grant that they give us is they give us funds to be able to work with law enforcement agencies to do alcohol stings. So we can send in underage youth with it's usually a sheriff's office deputy that goes in with them undercover. The kids really like it, y'all. They think they're hot stuff because they go in and they use their real ID and they attempt to purchase alcohol. If the clerk does what they're supposed to do, which we hope they do, we're not trying to nab them, right? We want them to do the right thing. If they do what they're supposed to do, they check the ID, they deny the sale, then everybody goes on about their business. If they don't, then the sheriff's office deputy that's there is able to issue a citation. And so we have found in Angelina County, we've been doing this for years, and we have found that really cuts down. If you let your retail stores know ahead of time, hey, we're going to be doing compliance checks, they don't sell. And we found that if we send a mass mailing to all of our retailers that are selling alcohol, we found this in Angelina County, we sent out a mass mailing and said, because our rates were pretty high. Out of the 40 checks we were doing, there were about 10 that were selling. And we're like, okay, this is not working. What's going on? So we sent out a letter and said, hey, we're coming. It might be you, it might not be you, so train your clerks. And our compliance, it went way down to where now we're only having 1 or 2 when we go out. So we're hoping to do the same thing here in Polk County. We just need a law enforcement agency to partner with us to be able to do that, because that contract goes through the law enforcement agency. So you can see we recognize the retailers on our social media that don't sell. And then also we do talk about the ones that do sell. We send them a toolkit to help them with some resources on training their employees, and then a little bit of negative publicity there. Another two components of environmental change are communication and education. And you can see that first picture is my coworker, JP Heath. He's the one that really covers Polk County. He went into Ms. Gokey's class and worked with those students and kind of educated them on some of the things that we're hoping that they are able to do in their drug-free council club. Her son, Danny, was our founding member, and he went over to the Eagle, to the radio station, and recorded a PSA. That's another great thing for kids. They really enjoy being able to do things like that. And then Brooke is another one of our drug-free council members. She wrote a letter to the editor for last month, September, and that was published in the Enterprise. And be looking, I think there's another one that's going to be. Is it in today's? Okay, great. I was going to say it should either be today's or this weekend's paper. Yeah, so we're working really hard to make sure that we're talking to the public about what these kids are doing and what they're passionate about. And then the last thing is advocacy and policy. And this is a part that really our kids get excited about. They don't understand it right at first, but when we talk to them about it and we train them on it, they really start to understand. So we train our kids to be empowered to give their message to local officials, state officials, and even, well, that picture doesn't have it, but even federal officials. We've met with our federal Congressman Pete Sessions to talk to those officials about what they are seeing in their schools and in their community, and what those local officials and state officials can do about it. So the first picture down here, that was Representative White. I think he covered y'all's area at first, or a couple years back. That's when we went to the Capitol and we met with him about raising the age to purchase tobacco from 18 to 21. And our kids, they had ownership in that. They met with several representatives up there, and that passed. That legislation passed that session. That's a real win for public health. To raise that age, but it was a real win for our kids. They felt so powerful that they helped make a change. And then, of course, in Angelina County, we meet very often with Trent Ashby, and that's also y'all's representative now, state representative. And there's a couple of things this session that we'll be meeting with him about. Specifically, we're looking at when they come into session in January, we really want them to remove the loophole that's in the Farm Ag Bill right now that's allowing all of this Delta 8, Delta 9 THC products to be sold in vape shops. Well, and not even in vape shops. They're in convenience stores and everywhere. If y'all have been in a convenience store lately, you've probably noticed all of the green plant signs that are everywhere, the wavy advertising guys, all of that. And all of those products are allowed because there's a loophole in the Farm Bill that allows for hemp to be farmed, but then business interests took that loophole and went into the lab and synthetically created THC that is intoxicating from hemp. It's kind of a convoluted process, but basically what the state did is they legalized marijuana. And so right now you can go into a convenience store and you can purchase vapes that have enough THC in them. The clerk, we've gone in and tried to purchase these items, and the clerks will assure us, oh, they'll get you high. That's concerning, y'all. And we need our representative to do something about that. So that'll be something that our kiddos will be meeting with them. And we're hoping some of our Livingston Drug-Free Council kids will be doing that. substances are bad for the adolescent brain specifically, right? They have that frontal cortex that has not developed, and when you start introducing harmful and addictive substances, that sets them up for addiction later in life. Most of y'all probably grew up at the same time that I did, where just say no was it, and that's really all they told us, right? Just say no. And that doesn't always work with today's kids. They want to know, well, why? And when we explain the science of the brain and addiction to them, they get it. They understand that if they use these substances before the age of 21, they're going to have problems later in life. And so when we can explain that to them, that really helps. Y'all are familiar with the risks of underage use. I'm pretty sure alcohol, tobacco, and marijuana, all of these products, if you start using them early, you are at risk for addiction later in life. Nearly 9 out of 10 current smokers started smoking before the age of 18. So that pretty much tells you it right there, right? If you start early, you're going to have problems later in life. And then same thing with marijuana. Before age 18, they're 4 to 7 more times likely to develop a marijuana use disorder. And that over there to the right, we also send a social media post every month to y'all's social media manager, and she posts that at the high school, and sometimes it's even shared over to the Livingston main page. And these posts are designed to help parents be able to talk to their kids about these things. A lot of times parents don't have the words, they don't know what to say, and so these posts really help them to be able to talk about it. And then other drugs, kind of the same thing, all of these different risks that we have. We're really seeing right now the connection between depression and substances. And the science is still emerging on whether it's the chicken or the egg. Is it that they use substances and that's causing, anxiety and depression? Or is it they already have anxiety and depression and then they start using substances and it amplifies it? There's a lot of science out there that's doing research on that. But the bottom line is they're not good together. When you have depression or any kind of mental issues, adding a substance in just makes it worse. There's another one of our posts that we shared. So this is information about in the East Texas region. This is from the Texas School Survey that was in 2022. So we're going to get some new 2024 data here pretty soon. But this is what we're seeing from our kids. This was grades 7 through 12. They asked the question, in the past 30 days, have you ever used these products? Alcohol, marijuana, and tobacco. And you can see the answers there. The alcohol one is super concerning, right? 30% of kids ages in grades 7 through 12 have said at some point in the last 30 days they've tried alcohol. And then the average age of first use, you can see it's right around that 12-13 time period. And then only 53% of students in grades 7 through 12 believe that their parents strongly disapprove of underage drinking. That tells us that parents aren't telling their kids, don't do this, I don't approve. And we need to help parents get those words and get those conversations going. Okay, so here is just a quick video on our Drug-Free Council. See if you can see some of your Livingston kiddos.
You can use the mouse and just click on the
double click.
The red. No, just click on the red play in the middle.
Am I clicking? I'm clicking. It's okay, we don't have to show the video.
Well, it played.
I know, it played earlier. No, that's okay. That's good. Y'all can...
How do I do that? Just like try.
That's just a suggestion. It's not even how you do it.
It's okay.
Hit escape.
Escape.
Escape?
Back to your PowerPoint.
Oh yeah, we lost yeah, but we lost it up there.
Okay. Windows.
It's posted on our social media page. It's okay.
We can't see anything.
No, we can't see anything. It is. Wouldn't mind going and visiting.
I don't know. What does duplicate mean? Duplicate is an option.
Duplicate the slide, it just means copy one slide.
No, it should.
No, it's on, okay.
Single screen's on. Yeah. So you need to have it back to single screen.
So is that F8?
I don't know that, I just did settings, go to.
I don't know what that means. Where do we have others?
Look at your function keys. The F's, see if one of those.
Just F8?
Does it give you options?
Extend, second screen only, duplicate.
Try duplicate.
Duplicate?
There.
Yeah, but I don't think that's gonna.
I mean, it's what you see, we see.
There it goes. Should be it. There we go. Okay, so as I said, we started our Livingston DFC right at the end of this school year. So we're looking forward to all this video being updated next year with all pictures of all of our high school kids over at Livingston doing all of those fun activities. They're working with Ms. Goki right now to plan out Red Ribbon Week activities, and they have lots of things planned over there at the high school. So
what is Sticker Shock?
Sticker Shock, yes. Project Sticker Shock is a campaign that we give as an option as a campus project that each DFC chooses a project to do each semester. And the ones that you saw, Wells and Corrigan, we also did it in Angelina County, they chose to do Sticker Shock. Sticker Shock is where the kids go out into the community. We get permission from the retailers, and they put warning stickers on packages of alcohol. Both of those groups did it right around the springtime with spring break, graduation, prom, all of those things. And those stickers just warned adults on what the consequences are of providing alcohol to minors. So we see that a lot in the spring. We also give them the option, and I think actually the Livingston DFC wants to do it at Christmas this year. And we have stickers that warn against drinking and driving that we go out and we put on all of the packages of alcohol. That's a great partnership that we have, like with Berkshire Brothers and some of the convenience stores that allow us to do that.
So it goes on the package, not
On the
just like
package.
door
Nope, on the package. Yeah, we have to be real careful about not putting it on the logo and, you know, the barcode, and we got to watch, make sure kids aren't just slap happy with the stickers. But yeah, it's a great partnership. Yeah, great question. Any other questions? My contact information is, there we go. there's my contact information and our social media pages. All of them are at the Coalition 936. We try to share from Livingston pages over to ours and vice versa. So encourage y'all to follow us and be able to watch out for the Livingston kiddos and see what they do. If you have an idea for a project, please let us know, and we can work with. The benefit of TxDOT is they can provide the funds for the different events that they want to do. So we can provide the money to buy the supplies for whatever activities they want to do. So any other questions? All right. Well, thanks for having me, and we're looking forward to a great year with our Livingston DFC. Oh, let me give this back. I don't want to keep this.
I could probably talk loud enough that it would pick it up across the room. Thank you for sharing that information with us. It's always nice to know that there are multiple agencies and people in our district that are, saying the same things to students. Try this side. I guess you'll let me know if I can't. Thank you. So we're looking forward to that too. I know that has been a long process, but we're glad that y'all are here and meeting with us. The next thing is regarding student health and the changes in the policy for over-the-counter medication. And I've included a link to Hawks Talks in August that's listed on our our website, our district website. We started watching this through the summer, and the nurses and I stayed in contact, and I would forward them the information that was coming. But the Texas Board of Nursing issued a statement. We've shared that statement. We pretty much used their wording to notify our parents. So always in the past, if a student sent Tylenol to the nurse or Oragel or any topical, medication, if they had a rash or something, then they could administer that with a parent note, and that has changed. And it was new, it rolled out. All the clarification died down just about the time school started, of course, and so we were trying to let our parents be aware of this change. And let them know that they would, in fact, to have a doctor's note in order to, or the nurse would have to have it in order to administer that medication. And so that, like I said, it was a quick turnaround for the beginning of school. And so we just, the nurses had letters, and I think they fielded most of the questions, and thank y'all for that. So we have several of our nurses here at this meeting this morning, and so I appreciate your efforts on getting the word out and explaining that to parents, because it is inconvenient, but it is also something that was, in order for our nurses to be in compliance with their licensing through the Texas Board of Nursing, it was something that, was put in place to protect them. And so we're not saying that we can't or we won't. We're just saying that if that's something that your child needs access to, or, for our parents, just make sure that a doctor has signed off on it, and, we'll be glad to accommodate. Nurses, do y'all have anything? Has it kind of slowed down, and we've kind of, it's always first, change is hard at first. So I think once we kind of got over that, it's kind of settled down, and the ones that truly needed it have done what they needed to do, and we're thankful for those parents that have done that. And so it's pretty much okay now. So let's see. Okay, T-Chat, I do want to share some information on T-Chat. This takes a little bit. Do I have one of the counselors here? Do y'all want to talk about T-Chat for just a minute?
T-Chat is an online counseling service it provides 4 to 6 sessions of counseling service to students that are enrolled at Livingston ISD. The counselors or administrators can refer them to the program. It's ran by Baylor College of Medicine and Texas Children, and it provides that online counseling and different things for kids that may need it for short term. And if they determine through those sessions that they need further beyond what they're doing, they can help the parents find somebody local to provide those services. Usually they contact us once we do the referral. They contact the parents, get all their permission and everything, and they do their intake session with the parents and the student online. And then usually the kids do those sessions during the school day. And they get with us. I had one the other day and got an email, okay, what time works for this student? And gave dates and times of appointments. And then they schedule and send you the appointments and the links. And we just have to provide the technology for them to be able to get on. And it works with all ages. We used it with first graders all the way through junior high kids. So, I mean, it does help, because we had a student last year that we referred through this. They went through the process. He was having some behavioral issues. It's like a different kid. We haven't had any of those same behaviors. He's even using things and bringing up things that he talked about in session this year to help him control himself and to be able to be more successful in the classroom and not have to come out for behavior and things like that.
I've referred 5 kids this year. I've had one little girl that finished. She was a first grader. Her intake, we did all of her sessions on campus. Mom came for the first session. They did intake together. It took about 2 hours. I have an additional area in my office, so I sat there because it's done in my office. She did all her sessions there. I would get everything ready, call her in from her first grade classroom. She'd come in, do a 30-minute session. I would sit in the back where I couldn't hear anything, but I had to be present because of her age. So she did all of hers. She did all 6. The counselor, they were able to find her a counselor here locally that's able to work with her and mom on costs and everything, so she is continuing hers. Like Robbie said, I can already see a big change in her behaviors. Then I've got a little boy now, he's in 4th grade. He and mom came in, they did the first session there. They were able to they're doing most of the sessions, or some of the sessions are done at home. Like he had one the week we were out. So they did that one at home. The other ones, he's coming into my office and I just sit back there and work on other stuff while he's sitting out there doing his session. But it's working really well. The parents really do appreciate it and like it.
Okay. Thank y'all for sharing. I just need a little bit before we can log in. It's a double verification, so I had to wait on the code. Yes, ma'am.
Well, the teachers can get with us. It can be any number of reasons. It can be behavioral. It
trauma.
can be if they need help. Just any number, any mental health issue that is coming up or any issue that is coming up, we can refer that.
The only one they will deny, I've seen, is suicide, ideation. They want face-to-face.
Yeah.
Right.
But
Most of your like crisis type things, they do recommend face-to-face.
I've done for like parents are divorcing and they're having issues, behavioral issues,
Anxiety,
depression, anxiety, any number of those. It hits. They have a list on some of their stuff of
The parents do have
yeah.
to agree.
Whether
Yeah.
the parent asks you for it or a teacher or whoever, you still have to call and get permission from the parent to say, your child, Johnny's been referred as someone who might benefit from this. They'll ask you what it is and you tell them. And 9 times out of 10, they're going to say, yes, I would appreciate that.
Because it is free.
It's free.
And if I remember correctly, the first meeting is with the parent and the student together.
That's
And
the
then the following meetings are the student and the
Any kind of counseling.
Yeah.
representative.
Consider your first appointment is going to be.
Yes.
Yeah, I just didn't know how many people here knew that, so I just wanted to
The
clarify.
last session, they do invite the parents
Yes.
to come up to participate
Yes.
with that one as well.
Yes.
So as I was waiting on the code to log in, thank y'all for sharing that. This is our dashboard for our districts, and it'll show you we have 26 that have referred, 9 have been assessed. 11 have not been assessed, and we have 4 that are pending assessment. So if they've not been assessed, I'm assuming that the parent declined or
Or they can't get
they
in
didn't
touch.
follow
Exactly.
through. So there is a piece of that that's out of our hands. They reach out to the parent and they have to make contact with the parent and schedule that first meeting. And if the parent, is unable to follow through with that, then we can always try again later,
When we do the referral, we provide parent names, and they try both methods to get a hold of the student.
And they do let us know if they're unable to contact the parent in order to do that. But I like it's it's documented.
It is. Insights is new, and it's very generic. So I think I have to do all referrals. This is the information that we get back. So this is all of the campuses in our district and all of our referrals. So we can look at referral status and see how we're doing. And maybe there's also training options if, how to, maybe have a conversation with parents so that they don't, feel as, some of that is personal and we want them to feel comfortable in the setting. And so this is a referral trend, our demographics. We can look at it by grade levels, gender, race, ethnicity, and then the reasons. And you were asking the reasons for the referrals. And it may be one of those things that it may not begin as a referral for one thing, but it ends up the root cause being something different, so it can change. So academic issues and truancy, anger, anxiety, excessive worry. Can y'all see those? Yep. Yeah. It just lists them. The left side seems to be what the majority of our students are struggling with. Attention problems, disruptive behaviors, low self-esteem, trauma, none of the above, and I'm not sure what that, it could be divorce. I'm not.
To put in what you may be recommending the referral for. And there's also a note to let them know as well. And the online providers, sometimes I will speak to them before the student comes in, kind of update them, because sometimes the student's not always honest with what's going on or any current activities. And it's just a heads up. And then sometimes they want to speak to us after,
Yeah.
which is good because we can kind of work together.
Yeah.
But I've never been there, like, the other counselors, we give them that complete privacy.
So this is the data. It's broken down pre-K through 2, and then you can see grades 3 through 5, the changes in the data, 6 through 8. Anxiety, excessive worry is at 100% of the, and that could be, 1 or 2 referrals. So, but it does change as the grade levels, and I thought that was an interesting perspective. I didn't think we had another. As you move up in the grade levels, and they deal with different things and issues that come out. So that is a way that we can look at kind of what's happening, with those students. And I can see it from a district level, but y'all should be able to access this too as well for your campus so that you can kind of know. And so from that, counselors are able to take that information and see, hopefully build their social skills lessons around that, or reach out to the health teachers, or to see if there's something that more informational things that we can give out, and specifically what we need to be talking about with kids in the event that if the majority of our kids are struggling in one area, there's a huge likelihood that we have more than those kids. Those kids have just been the ones to come forward. And so it helps us kind of focus in more on what we need to be talking about, with students, and makes us aware. Because some of this information, when you look at, you would think, I wouldn't think that a first grader would be worried about that, but they are. So that's just a way for us to monitor that. So, and our counselors and academic advisors on each campus are trained to do referrals. So there is a process that they go through with those students.
speaks both English and Spanish, but they're really more comfortable in Spanish.
We do not, to my knowledge. But we do have,
They offer services in Spanish.
through TRAC or through TChat,
Yes,
they have them.
that's the language of the parents and students.
And I think to explain that to parents, the counselors will bring in an interpreter and have that conversation prior to them actually accessing the program. So we have access to translators, but I don't know of any of our counselors or academic advisors or dean of students that speak Spanish. But that's something that we are aware of, and so we have, we do have help.
Yeah, I was going to ask about the whole bullying. You know how they have, or they'll have the little bullying reporting? Yeah.
Bullying? What?
Like the online reports, bullying reports.
Yes.
thing. Yeah.
It's more on the admin. See that? If we're needed for something, I know my principal
Yeah.
includes me in something, but that's just a tool that is used
Yeah.
so that we can address those issues. Well, I don't see that much on this end. And also it's educating the community on what really is bullying and what is not bullying.
Is that on our, so we have that link, is it on the homepage? Bullying. So if you go to the main page on our website and you scroll all the way to the bottom, we have a bullying report and it is anonymous. And I will say that sometimes that makes it difficult because we need to actually talk. Let's say I'll use me. If I make an anonymous bullying report, but she needs clarification on some things, or if they just say a student is doing this, well, what student? And we don't know who reported it, so it gets a little tricky sometimes. But this is the online bullying form. Y'all tell me if that goes down. This is the online bullying form that's on our website, and so a parent can access it, a student, a teacher. So that goes into what we call Crisis Go, and Crisis Go manages all of our reports so that the campus administration and I can get it. We get a notification when we have a bullying report that comes up through the system. We can go in and look at that. I'm not sure. I can maybe look at that next time to see, because I know I could only show you in T-Chat what was completely anonymous, but without names and all of that. I'll go in and see what we can pull up with Crisis Go and show you how we can monitor that. The main page really just shows the date that the report was made, which campus they were on, and the administrator that addressed it. So if an administrator, if it ends up being something that the counselors need to handle or need to have input in, then they will refer that to the counselors, the academic advisors, and dean of students, and they will get involved at that point. So, but did I answer your?
We have a bullying, is it a committee, or I know we've done reports.
Every campus has a bullying committee.
And then when we have to do an investigation, there's a specific documentation that we use. I know I've filled it out several times. I'm just
Yes. So that is the documentation that she is asking about we do have to identify whether or not it's a true bullying situation. That is one of the steps, because sometimes it's name calling and it's not a true bullying situation. And so we have to talk the parents and the students through it some. If it is a true bullying that's going on, then there is a more formal report. It's an investigative report. And I will do that next time. I can show you the blank one. I think I have I do have access to the blank one. It's a little bit more in depth. What happened? Where did it happen? Who was involved? Do we need to consider, Title IX concerns? Are there any of those things there? So it's more in depth. Both the victim and the perpetrator, their parents are contacted. We have our regulations require us to go through certain steps when it's a true bullying incident. And then there's a place for the committee, when the committee meets, on the campus, any supportive measures that they put in place to support both students. That's one of those situations that both of those students need supports because, the student that has been bullied needs, supports in dealing with it. And so we put supportive measures in place too, but the student that's doing the bullying also needs some supportive measures in place too. So we work with both the parents. Sometimes T-chat is a result, sometimes it depends. It's kind of individualized as far as who we need to get involved and what's, in order to make those supports happen. Yeah. Esteem is, do y'all want to talk about that? That's the curriculum that the Shac committee recommended to the board. Yeah, it is new, yeah.
I'm not happy with it.
It's different.
It's health. I'm a counselor and I'm teaching health classes.
So we talked about that, and we talked about maybe working some of those parts through PE and having incorporated in your PE classes if it deals with health or if it deals with, I know some of the school-based officers are involved on the legal parts of it, so that might be.
A majority of the new part is the health, the part that goes home, the work that goes home is what we used to do that was actually productive at school. It's not engaging, we can talk about later, but.
Yeah.
I'm not as happy with them as the first one.
So those changes are also reflective of the TEKS.
Yeah.
The changes that were made in the TEKS as far as health, so.
That is, more of our lane is where it's hard for me because that's where it was so beneficial when we did LISD. What I've been doing is I've been using a resource, CKH resources with the esteem to add the mental health component to that. And that's what's helping make it successful.
Well, and we use Capturing Kids' Hearts too in the district, so that's fine to combine the two if, absolutely.
It goes well. The biggest issue we're having on our campus is the components that our nurses doing because we have students that have different needs and the time of day that she is able to do that with our fifth, because we do fifth grade. And at the end of the day, there's things going on. There's times when she's scheduled to do her esteem and something comes up, or she has to address some of our students that have higher health care needs, that it's causing conflicts of her being able to do the ones that are like first aid and different things like that. So, and it's causing her stress because she's having to cancel at the last minute because of different things and all of that. And I know, like, our resource officer has recently changed. So our current resource officer has received none of the training. Yeah. So I don't feel comfortable them providing that lessons. So I'm doing all the lessons that the nurse is not comfortable doing based on the healthcare stuff.
Yeah.
So, and scheduling is the biggest issue.
And my nurse only does the two. She only does the two.
Yeah.
And it's
So, and that's happening, I know right now we're doing 5th, 7th, and 9th grades. So it's on all of our elementaries, junior high, and high school. So and those are just concerns we probably need to sit down and kind of work through again since there has been some changes.
But I can say getting the curriculum earlier this year, making it easier to get the lessons scheduled and taken care of. Because right now, how I scheduled it, I should be done towards the end of January. But, and even if I have to cancel.
Before testing.
Yes, because when I made my schedule, our kids, 4th and 5th graders are currently skating, and I don't want to take them out of skating to do a STEAM. So I'm going to, because they would not like me very much.
No, they would not.
So I'm going to postpone the 2 weeks that I'm supposed to do to be able to the end. So, even with postponing 2 weeks, we're still able to finish before any testing or before any spring activities, because it was chaotic trying to get everything in last year.
Yes.
Because they added even more lessons last year.
Yeah,
when
they
we
added
first
4 more.
did the trainings and everything. So
good.
And the TEKS that the STEAM is hitting, if those are mandatory TEKS, not all students are getting that because this is permission based. So we might want to think about that as well.
Yeah, I agree. But they're also being taught in PE too as well, so the health pieces of it too, so.
Good.
Just as a reminder, and we talked about this, we did offer the Stop the Bleed training to our 7th through 12th grade students, and we worked with Karen Pollard and with CHI and came in and we offered the hands-on training to our students. The online course is just as kind of a general overview. In order to actually receive a certificate, they have to come in and do the hands-on. And so we did not have any students that elected to come and participate in the hands-on, but our health teachers did a really good job, and our PE teachers of encouraging students to at least go on and do the online piece of it. So. Food service could not be here today. They were in the middle of an audit. They did ask that I mention the Flavor Fest and the Menu Advisory Committee, if we have anyone that's interested in serving on that. And I believe at our next meeting, she would like to have that meeting following the Shac meeting. And so they did have different vendors come in. And I believe our culinary arts students were able to test some of the foods and taste them and give them some feedback during that process. But she will be here at our next meeting. And the last thing is the staff health. We did partner with Walmart and completed a vaccination clinic the 16th through the 18th. And I believe they had an option to get flu, shingles, COVID, the new version. They didn't do Tdap, but the new COVID vaccine, it was not a what? Yeah, it was the new one. It wasn't the booster. Thank you. So they did have that option, and I was anyone. We also offered it to their spouses too as well, but I don't think they took anyone under the age of 18. So, was it? Do you recall your numbers? Do you know how many did y'all have at your campus?
12, 15.
Okay.
About 10.
So and it's hard to, it's not hard, but it does take some managing. It was done over a 3-day process, and they went to each campus. The nurses maintained the sign-up sheets and the vaccines that they were interested in prior to, and then they were able to go to the different campuses in order to, I think we did 2 campuses a day to make sure that we were able to get them set up at each one of the campuses. So. Does anyone from our community organizations have anything to share with us, or does anybody have any questions? Or yeah, absolutely. Okay. Again, thank you for coming, and we certainly appreciate it. Our next meeting is November the 22nd. If you'll just go ahead and put that on your agenda. Should be same time, same place, but let me check if I have it on here. We were still.
November 22nd?
22nd. It's a staff development day. And I have not scheduled a time yet, but we will try to keep it 9 and here as well. Same location. Thank you so much. Y'all have a good day.